Hello and welcome again to another episode of Ask Your Doctors. Remember, you set the agenda here. You ask us questions and we get you experts to give you the answers. Once more, we are fortunate to have the presence of clinical psychologist from Hatfield, Pretoria, Ms. Leta Silamulela. Hello, ma'am. How are you?
I'm well and you. Thank you for inviting me.
Thank you for your return. Yes, thank you. It's the end of January. We had to go and fetch you so that you and I can have a heart-to-heart conversation about a topic that is bothering many of us, a topic that is a hard one to be discussed in South African settings. It is estimated that we are one of the drunkest countries in the world, if we have to put it that way. I don't have good words to put it. We have a very high incidence of fetal alcohol syndrome, where a lady would continue drinking well into her pregnancy, and children are born with the symptoms of fetal alcohol syndrome. We have teenage drinking at levels that are comparable with the highest in the world, and when we drink, we binge. We don't do one drink a night, whatever, one glass of wine. No, that's not for us. So a lot of people know that this is a problem. We have drunk driving. We are the most lenient country on drunk driving. Our samples disappear in the system and people don't get their results for 5 years. Cases are pending. So it's a crisis that we just don't sit down to admit to. Let's say an individual says, I want to deal with it, you know, and the person wants to know, I've tried to do a dry January, and obviously my friends don't tell me to stop because I buy them the alcohol myself, so, but now I've decided I want to stop. So let you and I have a conversation about, let's say, pre-rehab and circumstances surrounding rehab. You and I, let's give people a little bit of knowledge about what you and I know on circumstances that sometimes go on in the head, sometimes go on within the family setup, having to do with rehab. Is that one of the solutions? Can people get counseling to stop drinking? I know at some point they said our field, dentists, could help people quit smoking by putting things in their mouth and doing this and that. So you never know where the answers could come from. But let's discuss. You've now tried dry January. What else can you do? You know, how do I know I need help with alcohol addiction?
Okay. Well, maybe first we need to understand what addiction is, so that one can be, equipped in terms of knowledge regarding whether they need help or not. So addiction is obviously something that occurs persistently, like with regards to alcohol or substance, can be drugs as well, and which have a harmful effect as well. You know that this will have a harmful effect, but you continually do it. And most often, it gets done secretly. And there's most of the time you even deny the fact that you are actually having a problem. You start even hiding when you're drinking or using the drugs.
So that's how we start knowing.
Yes, and it will affect your relationships. It starts affecting your relationship, personal, social, and it also affects your job. You start losing concentration at work, or you start banking work. You don't even go to work. And it affects your performance at work. And if it's maybe somebody who's still at school, because it can be drugs, it can be a teenager, it can be youth, it will affect their academic performance as well.
And these problems do not have to manifest the same way at the same time all the time.
Yes.
Sometimes one dominates.
Yes.
And
most often the poor insight, the person will deny. That's how come the family members come in, or the significant others, people that are close to you, people that can see that there is definitely a change in mood, there is a change in behavior. You know, those people are most often the ones that help the individuals that are having the addiction problem.
Because others don't manifest immediately.
Yes.
You don't lose your job immediately. You don't use a relationship immediately. So with your children, with your family, they can be patient with you.
Yes.
And but sometimes the problem is simmering. You know, I understand what you're saying. They don't have to manifest all at the same time.
Yeah. But and also there might be financial difficulties as well, because you have to feed the addiction.
But some may come later if you have deep pockets.
Yes.
So it takes longer for you
course.
to realize you have problems.
Yes.
Yeah. No, I understand you. Now, it's late January. You've tried Detox, and we are bordering now on, is it Detox or is it Rehab that I need? From what I can gather, you and I are not experts on the subject, but let's have this talk anyway for the benefit of our audience. One of the audience members asked, what's the difference between Rehab and Detox, and when do I know when to choose one? And outright, I would say, if you sleep normally, like 5 hours at least, between 5 and 8 hours, your liver usually gets a chance to recover. You know, your liver manufactures enzymes that actually make you well. And they digest alcohol and they do this and that. And you manufacture enzymes that function in other parts of the body, most of them manufactured in the liver. So to do a liver detox, do the simple thing. Get in bed. Give yourself enough hours. Sleep when people sleep and wake up when people wake up. And don't do cross night in the middle of January, end of January. Find yourself sleeping, you know. You're not counting down to 12 o'clock 1st of January anymore. Try and sleep. So that's detox. You know, drink water, eat vegetables. You can Google what kind of foods can help you with detox. I know what I used to do detox, because I often take a lot of meds for my allergies, and sometimes I feel like I want to detox. And it works on your skin as well. I take turmeric and I do something called golden milk, where I mix milk with sugar. But because I don't take normal milk, lactose intolerant, I take, and I read this on the internet, and I watched a lot of YouTube videos talking about the advantages of using golden milk. If you wanna be, if you wanna be like me and start detoxing on your own, YouTube, and don't just listen to one, you know, hack and then go and practice it quickly. Listen to a few and be critical, compare them. You know, listen to some experts talk like on a show like this one. You know, so I use rice milk powder to mix with turmeric, boil it. Bring it to a boil, makes a nice warm drink.
And it works for you.
And where I sweat, I sleep in the morning. My sleep is very deep. You know, I sweat and I sleep, and I feel detox, and my appetite improves after that.
Okay.
Yeah, although it makes me tired for a while, but you know, that's how I detox. People use green tea. People use, as long as it's not alcohol, it's not drugs. Most of the things that we consume, and it's not too much caffeine or not too much sugar. A lot of these things are very helpful.
Yeah.
So people can detox. You must read up on detox techniques.
Yeah.
But you and I are gonna analyze. I'm gonna tell people how they can analyze their situation, their family situation, to see if they need to seek help for rehab. Now that's the one we're going to talk about today.
Yes, and then, well, coming to rehab in particularly, when they get to a stage what is called the withdrawal symptoms, when they can't live without the drug.
Yeah.
And the minute they go off the drug or the alcohol, they start feeling very, very tired. They have to sleep. For them to pick up, they have to get the drug. They definitely need to go and consult and be put for rehab, because that stage is very critical.
Okay. And we'll discuss later the stages that we need to go through to, the things that we need to go through when we realize that, the process that we need to go through when we realize that we need to start talking about rehab with a family member.
Yes.
Okay. Don't forget, later on we will go viral and consult with our virologist, Dr. Bunolo Mashishi, as we continue. What cases do you come across where people look like they need rehab? And we're coming closer to where we discuss the process now. But any cases that strike you in your working experience?
Most often, when they get to my office, is the family members that bring the person. And remember, I only work with voluntary patients. Okay. You know, when they are still not accepting that they definitely need help, it's not in my position to actually assist them. So the number one thing is they must be inside. You know, when somebody realizes that definitely I do need help, that's when I come in. But still, the person needs to detox, you know, get off the drug before we can get into the root of the problem, because the drug might be the symptom to handle that particular problem that they are facing, like the particular problem that is the one that led to drug or alcohol abuse. So I deal with the root cause, so that, you know, to prevent the relapse.
What cognitive patterns do you pick up on people that are now addicts?
Okay, it differs from person to person. There is no set rule that this person is like this or like that, but mainly it definitely affects their cognitive patterns. Some you'll find the think process becomes slow, they lose concentration, they can't focus. So it differs from person to person, but it definitely affects their cognitive patterns in terms of how they look at their life demands and all that. Yeah.
On my way to becoming a willing participant in the solutions to my problems, how do I pick up? How do I pick up? How do I acknowledge?
Okay, first of all, the minute you have insight that you need help, that is the first step. That, you know, I need to deal with this issue. That is where we start. That is how you can help yourself. But the more you are keeping it a secret and saying, I don't have a problem, the problem will persist and you will not get out of it. Because even if the family members try to push you into rehab, try to find help for you, the fact that you don't see a problem, the problem will not go away. So the number one thing is inside, that I definitely need help.
And the truth is, let's say for instance, they say a car uses petrol. Now I'll use Dr. Minga's examples. A car uses petrol. If you find yourself putting water in that car, and that car continues to run, at some point that car is going to seize, because you're not supposed to be putting water in that car. Human body uses water and food and relationships with others, and you work to become functional. As soon as you find yourself, you are putting more petrol or alcohol in your car, then that's not going to work.
It's like you're putting poison. You are killing yourself on a daily basis. So if you don't have that insight that I need help, eventually you will die.
I've had research that said even one drop of alcohol is one drop too many. I've had people in the past who were told one glass of wine, one shot of spirit, one glass of beer, but look, you and I are not experts in this one, but on the volumes that you have to watch out for. But if you drink every day, then you need to watch out.
Yes.
There's something there that you need to be out.
And as you are saying that the alcohol is a symptom to handle whatever challenge that is there. But once the person deal with it, it can be low self-esteem. It can be, you know, relationship problems. Whatever the challenge is, it needs to be dealt with. And once the person cannot address those, maybe they won't need the alcohol anymore.
On the funny side. Okay, I won't go to that funny side. Where the root of the problem is. Okay.
Yes,
what
but they need to consult, and obviously the therapies that they attend will do an assessment
Yeah.
of what the root problem might be.
Okay. One of these days, we'll get the guys that deal with rehab to tell us their side of the story. But today we have you. In your line of work, how do you find addiction affects families?
Okay, families are systems, and you find that there are functional families and there are dysfunctional families. So addiction is, as I said earlier, a way of handling a particular relationship. So when there is addiction, there will be some form of, dysfunctionality, within a particular family. So I'm just going to give an example that if it's a father that is battling with addiction, you might find the father now stops certain responsibilities that they used to carry out within that particular family. And it will obviously affect everybody in the family. If it's a child, a teenager, for instance, they drop with their academics, they become ill there and there, so the whole family is affected. Now the focus shifts from other things to that kind of an individual. So definitely addiction does affect family members.
While we're there, if a family picks up that they would like assistance, what's the first point of call? What do they do? Do you take the addicted person and dump them at your door, or can you counsel the whole family? How do we make this in the safest possible way to work for the whole family?
For the purpose of this interview, what I would just say is they just need to consult with a professional because they need to do an assessment. If there's a problem with the family, as I said, some families can be dysfunctional and, lead that particular individual to the addiction. It might be the family that needs help, but sometimes it's that particular individual only. And if you change that individual, the family might change. Yes.
And I can tell you outright, when I ask this question, what comes to mind is that sometimes the addiction can get so bad that in certain families, family members need counseling just to cope with what's going on in the family at the time.
Because it can also be traumatic. It can cause trauma. With what I've worked with, Dr. K, you find that some individuals start selling things.
Or just to feed the addiction?
Yes.
Okay.
They start becoming aggressive. They start becoming abusive to the family members. So it can get very serious where they definitely need help as a family. You find even a mother saying that I wish my son would die. It gets to that, it gets that serious, and they definitely need help. When it gets there, you can see that the mother is traumatized. It's painful for the mother.
Yeah, I hear what you're saying, but I know of personal situations where family members have found themselves in that situation.
Yeah, and they need support. Some get support from their pastors, their churches, social workers. I think they can also make use of those kind of facilities.
Support structures.
Yeah.
How can you tell now you need rehabilitation? Remember, guys, we are at the end of January. You've tried the dry January thing. It doesn't seem to have worked. You're still drinking 4, 5, 6 beers a day and you feel like it's normal, but it's not looking like it will stop into February anyway. How does one know that they need help? They need rehab.
Yes, when it gets to a level that you're experiencing withdrawal symptoms and
If
you cannot, you cannot stop by yourself.
Now I see.
You are fully dependent on that particular drug or alcohol, whatever substance, then you definitely need.
I could say it's when you run out of money, but we do take many loans before we realize that we actually don't have money to feed the habit.
Yeah.
Or like you said, you sell things in the house. Anyway, there's a social media gimmick that's called Dry January. I've mentioned it a few times. Do you think social media plays a positive pressure on, it can put positive pressure on most of it, on us, or is most of it just negative? Let's say a campaign like this was to be followed and people start, or does it even work, social media, on such positive campaigns?
Social media plays a very crucial role, especially in today's day. You know, it's just that people need to follow the right information for them to get help. You understand? But how do you know that this is just deception and this is the right?
Yes.
You know?
I was about to say, how do you know when social media is honestly trying to help you or trying to prey on you? Because social media can either eat you alive or make you more alive, you know?
So in today's day, I would still say go for professional help.
Yeah.
It is the safest way.
Right, January, we gave it a try. Shame. I went back to the gym and I tried a few things, and at least so far I'm sustaining it. It might not show, but don't worry. Let's give it another 6 months. So addiction, how long does treatment take if you go for rehab? I know you and I are not,
well,
we
I'm
don't
not a
run
rehab, yes,
centers,
but yeah.
on average, what are the signs that you can now go back home?
Yeah, you know, research say 21 days to deal with a habit, to break a habit. But obviously, you know, the different rehabilitations serve different treatment programs. I believe one can find out from those rehabilitation
centers.
Yeah, some have a 12-week program. And they definitely do have beautiful programs, but 21 days is like minimum to break a pattern.
I think what we're trying to establish here is there hope? Can one go to rehab and be
Yes.
functional afterwards?
Yes.
That's what we're trying to. We're trying to give hope to our people. You
Yes,
understand?
yes, definitely one can go to a rehab and get, I mean, there's a lot of success stories out there, and there's a lot of stories of people relapsing, but that's how come
My
people...
next question.
Oh, yes, okay, that's beautiful, because relapse basically means that something triggered, you know, the habit. So that's why even after the rehab, people need to go for assessment and still find the root cause of the challenge and deal with the root cause. Then when you've dealt with the root cause, what will be the trigger?
Someone has been abused, the abuser is still there when they come back from rehab, it might be another problem.
Yes. Yes, so we need to deal with the root
So that's when they seek more professional help to be counseled and assessed for
after breaking the habit.
the state of readiness to face reality.
Yeah.
And not everyone has a strong will where they'll come back and say, I'll face reality. Especially children, especially teenagers.
Yes, definitely.
So guys out there, well, for these things to work, you have to be willing to face reality, but also you need to be assessed whether you are ready. And sometimes you need counseling for people to assess whether the problems that are making you go into the state of addiction are going away or not. Sometimes, I suppose you involve social workers when it matters. Sometimes, Yeah, what advice would you give to someone as we speak that has tried to deal with an addiction, or how do you face reality to say, yes, I am an addict?
Yeah.
What advice would you do? One or two things that one must...
Yeah, my advice would be that realize that there's a problem, and the fact that there's a problem is not the end of the world. You know, when you realize there's a problem, it is time for you to grow. It is time for you to, you know, have the best version of you. It doesn't mean that you are crazy or anything, but you're trying to help yourself. So when you realize that there's a problem, seek for help. You're actually loving yourself by seeking for help, other than trying to
run away from it.
Or keep it a secret. Because
You're
you will
not
never
weak.
grow. Yeah, you're not weak. I think that is the best way.
You can't drink 10 beers, you're not weak.
Yes. You know, but if you don't have the discipline, it means you need help.
Okay. Thank you very much, ma'am. Before we close, I'll go viral. We go viral with our virologist, Dr. Bunolo Mashishi. If Bunolo can just tell us, please, what are spike proteins, and actually we want to know what causes mutations, because now we have variants and stuff like that. Over to you, Bunolo.
Spike protein is the protein that the virus uses to enter the body and infect the cells in our bodies. So waves are what we see when we start seeing a high number of cases rising in our community. A number of reasons can be due to this. The behavior of the virus, people coming into contact with each other, the number of people who remain unprotected against the virus.
Thank you, Bunolo. Always informative and inspiring, despite the COVID that you always offload on us. Speaking of offloading, what do you advise people when they consider to seek psychological help? Some people say, I'll appear weak. We finished on that point earlier on. But why should people go and seek psychological help? I know why they should, but please tell our audience.
Well, going to see a psychologist, as you said earlier, is not that somebody is weak. And most often, when you feel very vulnerable, when you feel, you can't see, your future, things, you feel hopeless, you feel helpless, you don't know where to go, going and seeking psychological help might be the time. And you will never be judged. It is the safest way to,
Because you are professionals.
Yes, you will feel there, you will leave that place feeling empowered, feeling energized, looking forward,
feeling
to the
offloaded.
future. Yes, and you know that your things will be kept safe. A psychologist won't go to your next door neighbor and tell your stories, It is the safest
But that's another
place.
reason why. If you want to avoid family gossip and
Exactly.
gossip between friends about your issues,
Yeah, and they're actually trained to give you expert advice because psychologist is trained that, to handle you psychologically, to handle somebody who's vulnerable, and also to assist somebody who has maladaptive behaviors to replace them with adaptive ones.
Yeah.
So
to get you well,
yes,
to get you back on your feet.
Yes. So I would actually recommend for people to go seek psychological assistance.
Okay, guys out there, you can go to our socials, you can go to our website and leave your questions and comments there. And when you go to our website next time, you will find Meleta Silamulela's details on our website. But if you don't find them there, where do we find you?
My website is www.letaconsulting.co.za. It has all my details there.
Okay.
Yes.
Thank you very much. I believe you're also on Instagram and Facebook?
Yes.
Yes,
Yes.
thank you very much.
Yes.
No, thank you for your treat, and I hope to see you again. Our audience will probably ask us more questions that will be directed at you. Okay. So we will follow up one of these days. Please be kind enough to avail yourself again.
Okay.
And to the audience out there, please continue to ask away, and thank you for watching. Bye.
Thank you.